Hi, guys. To anybody who's in the attendees panel, hi, we are simply waiting for a couple of our members to join. If you intend to make a comment tonight, it would be very helpful if you could go in and change your screen name so that we know exactly who we're bringing over. Be very helpful, and we'll just wait another couple minutes until we have quorum. Can we keep an eye out for, well, first of all, I'm going to go shut the door on my dog. Thank you, George. I'll be right back. And if somebody could keep an eye out for Leo and Anime and Tim, thanks.
I saw Tim in the attendees list,
Okay.
but I don't see Leo or Anime.
Okay. I'm going to bring Tim over. I just spoke to Leo not so very long ago. Did I lose Tim?
Leo says Leo says the link isn't working for him.
Okay.
Okay, I will send him another one.
Okay, I do want to let our attendees know that we will not be taking any questions through the question and answer box. So if you want to make a comment, please, at the end of Dr. Marsden's presentation, we will have plenty of time for listening. But we will not be taking questions through that venue, nor will we be looking at them. However, the comment form that we sent out with the Aspen email will be resent tomorrow with both the link and the recording to this. And once we're able to kind of officially call it, I'd like to have at least Anime or Leo in.
Is Owen the host, or are you the host, Jess?
I think Michael is the host.
Oh, Michael. Okay.
Yeah, I don't see Anime yet.
Well, I won't miss Zoom. And again, for those of you who have joined us, thank you so much. We're kind of trying to get the two other members of the committee into the meeting. There are a lot of people joining all at once, and so sometimes it can get a little clogged up, but we will be beginning the meeting very soon. And again, I see in the attendees list several names that are not full names. And it would be very helpful if you plan on making a comment tonight through Zoom and video for you to put your full name in there. And we will not be taking questions in the Q&A. And you are free to continue to fill out the comment form that we sent through Aspen, and we'll resend again tomorrow up into next Monday. All right. So all right. How are we doing on getting?
I think Leo's in now.
Okay.
Animation.
All right. Well, there you go. Usually it's me floating through the interwebs, completely disembodied, trying to figure out how to get in, but not tonight. So, all right, Michael, do you want to hit recording? So I'm not.
It's recording now.
Is
Okay.
recording.
Thank you. So, if we are all set to start, looks like it. I've got Leo. I'm just waiting for Anime's icon to come up. All right, well, in the meantime, again, since we've had about another 25 people join us, this is the last time I said it, tonight we will be not taking question and answer through the question and answer function. We'll only be taking questions or specifically comments through video. This is very much a listening session and not a talking back and forth session. We will be taking notes. We may ask clarifying questions. You are welcome to continue to give us comments, or if you have follow-up comments after this meeting, if you would like to do that through the parent information or the parent comment sheet, you are more than welcome to do that, and we'll send that out again tomorrow. Are we still having enough time with Anime? Because I think I'd like to get going.
Madam Chair, she can join as soon as we get started. So
Okay.
if you want to get open it up and then we can get going.
Let's do that then. Thanks. All right. So what I'd like to do now is call to order this meeting of the Medfield School Committee on August 16th, 2021 at 7:09 p.m. with a roll call, which is necessary because we are doing this in remote. Do I hear from Leo Brown?
Here.
Okay. Tim Knight.
Present.
All right. Megan Glenn.
Here.
All right. We know Anime is here, but she's going to come in and join us later in the meeting. So Jessica Riley here. Okay. Good evening and thank you for being here. I do want to let you know that this meeting is being recorded. Also, as posted by the town clerk on Thursday, August 12th, several members of the Board of Health are attending the forum from the audience. And we have Kathy Thompson, who is our nurse leader for the Medfield Public Schools and a member of the Board of Health here in the meeting with us as a panelist. Tonight, we have a single agenda item, which is a parent forum on the September opening. And what I'd like to do before Dr. Marston begins his presentation of the background, kind of where we are now, is kind of give you an overview how things are going to go tonight. And as we go through the night, I will probably repeat this message. So participants, as they come in and out, they'll understand the context and the format of our commenting tonight. First, Dr. Marsden will give an overview of the guidance provided jointly by the Massachusetts Department of Public Health and the Department of Elementary and Secondary Education late last month. And then after that, the meeting is to a large extent open to your reflections and thoughts. Specifically concerning the guidance, which is the framework from which we will be making our decision about the opening in September. We will take notes as a committee and possibly ask clarifying questions, but otherwise we will be listening. And I want to assure you this, we will not be judging. We will not be agreeing or disagreeing or trying to vet your statements. And we will not refute or debate anyone's specific comment. We would like it if you could keep your comments focused on your opinion, in your views, and you don't comment to refute another participant's input. And because of this listening stance, we would like to take tonight, I'm going to ask you now to check any and all comments, citations, evidence, or statements made as fact through a trusted source, and we will endeavor to do the same. As a veteran of many kind of public reflection opportunities, I would also caution you not to worry that your side is not having enough commenters to weigh in or to shift our views. This is very much, every option has a group of supporters. And this is not a popularity vote. This is truly a reflection and listening session. So all comments made here tonight should be live and on video. If possible, if you are only phoning in, we still need to know your full name. And from parents of students attending our schools. We will not monitor the Q&A. And if you have additional or thoughts or questions after the forum, we will resend parents the link to the comment form, along with the link to tonight's meeting. And that link will be open until 5 p.m. next Monday, when the committee intends to deliberate and vote on the September opening guidelines. And with that, I will hand it off to Dr. Marston. Thank you for letting me have that introduction.
Thank you, Madam Chair. As you mentioned, I'm going to do a very brief presentation on the guidance that was submitted to us by DESE and the Department of Public Health on the 30th of July, and then some updated guidance that came out a couple of days ago around quarantine. So I'm going to pull that up on the screen share right now. Can you see that?
Mm-hmm.
All right, good. So before we get started, I just want to really thank everyone for the last 16, 17, 18 months. Without the one Medfield and everyone working together, we wouldn't have gotten our kids back in last year and had a successful end of the school year with all of our kids in person. Just really want to thank our students for being so flexible, and our teachers for working really hard, our nurses, teacher assistants, administrators, custodians, secretaries, cafeteria workers, and all of our other staff. Certainly our parents, who are a huge player in the child's education, extremely supportive and worked hard last year as well. Medfield School Committee for all your support and guidance, and many, many, many hours you put in last year, whether it was negotiating or just having meetings like we're doing this evening. Medfield Board of Health, their expertise, they've been wonderful to us, giving us their opinions on certain issues. I think, we're blessed. I was in a meeting today with superintendents from across the state, and there are many boards of health across the state that don't have both public health and medical professionals like Medfield does. So we're really fortunate to have that and appreciate their input. Our community members with their support during the entire year, and then the town of Medfield with their ongoing support, and certainly the work we did with the various grants to buy PPE and other supplies for the school year in partnership with the town. So I just wanted to, before we get started on the guidance, just thank everyone for their support over the past 16 months. So two really important statements that came out of the guidance on the 30th. One is that all districts and schools be required to be in person, full-time, 5 days a week. And I think that's just really critical for us going forward, that is what we're doing. No matter what the decision is around any of the other guidance, your kids and our kids will be in school for a full-time for 5 days, and that's critical to us. Something we've been waiting for. Certainly we started in January with kindergarten last year and got all of our kids back by April. And I think that we're looking forward to a year of 5 days of full in-person learning. And the other piece is that DESE and DPH also continues to encourage schools to maintain ventilation upgrades from the past year as feasible, continue to hand hygiene practices, and extend policies for students and staff to stay home when sick. So I think I want to just review a little bit some of the work that we did last year that continues now, just so that, again, no matter what decision takes place, these are the ventilation improvements that we have in our district that really are the key. When you look at the science around this, ventilation is the key to prevent spread along with masking. So HVAC systems were repaired and upgraded. Again, we did that again this year. Exhaust fans and unit vents were repaired. We put MERV 13 filters in our HVAC system and changed them 3 times during the year, which was well beyond what we needed to do, but we thought that was an important piece to do. Our MERV 8 filters were in the unit vents. So the unit vents are the small units in each classroom that circulate air, and we replaced those on the same schedule as well. HVAC fresh air settings were increased to 80%, and we talked a lot about that last year, how it's typically around 15%, and we did our settings to fresh air of 80%, which keeps that fresh air circulating and the air exchange circulating in the classrooms and the schools throughout the day. We have the Austin air purification systems in all classrooms at Dale and Wheelock because they're not outfitted with an HVAC system. And we also have 4 of those in each cafeteria in the district starting this school year. So we purchased additional Austin filter purification systems, and they'll be in our cafeterias as well. Our classroom windows were open during the school day, and I know sometimes that was difficult, especially in the winter, but it really increased those air exchanges in the classroom. We felt that was important to keep doing. And then we conducted air quality tests throughout the school year when we were with no students in the hybrid model. And then again, we had all students in at full in person. So air quality was good, and we'll continue to do some of that work again this year. So 3 key areas that came out of the guidance that I'm going to share this evening. Number one, I think probably the one that everyone's talking about across the country and even in our state is about masking. And certainly there are views on both sides of that. We've received feedback from parents and community members, and I know that in the meetings that I'm having with my colleagues, that's pretty much what folks are talking about around the masking guidance. The COVID-19 testing highlights some of the guidance around that. As you know, we got a lot of positive publicity last year around our COVID-19 testing that we did with our pool testing initiative. And we'll continue that again this year. And then some contact tracing and quarantine protocols that have changed within this guidance. So in terms of the masking, DESE and DPH strongly recommend that all students in kindergarten through grade 6 wear masks when indoors, except where students who cannot do so due to medical conditions or behavioral needs. Masks are not necessary outdoors and may be removed while eating indoors. So very different from what we got last year with guidance, but again, some movement in making sure that masks are not necessarily outdoors and that students can remove them while eating indoors, which is very different than what we had at the beginning of last year. DESE and DPH also strongly recommend that unvaccinated staff at all grades, unvaccinated students in grades 7 and above, and unvaccinated visitors wear masks indoors. And then DESE and DPH recommend that all schools allow vaccinated students to remain unmasked. Any individual at higher risk for severe disease from COVID or with a household member who is at high risk is encouraged to mask regardless of vaccination status. Any child or family who prefers to mask at school should be supported in that choice. And by federal public order, all students and staff are required to wear a mask on school buses at this time. So, there's some tension there because you might be saying to yourself, well, if my child is in high school and they're saying they don't have to wear a mask, but they still have to wear a mask in the school buses, the federal law overrides what the local or the state recommendation is on that, and will still be required to wear a mask on school buses. Windows will still be open like we did last year. Air circulation is critical, as we know, with the virus. And again, that was difficult. We know during the winter time last year, we got some calls on that, but we want to make sure that kids are safe, and that's the recommendation for air circulation and ventilation within a school bus. All staff and students must wear a mask while in school health offices. And that came down really because that if a student is in the health office, there's always that potential that student may be positive. So everyone that's in the health office needs to make sure that they are wearing a mask. So looking at testing, as I said earlier, we had done a full pool testing. We started with our secondary students and then brought that down to Dale Street 4 and 5 last year. And then early in December, we started using the Buy Next Now testing, which is very successful for us. If you were a student or a parent of a student who may have been a close contact, our nurses did a phenomenal job hosting clinics and doing the testing. It allowed us to get some real time within 15 minutes what the status was of the student, whether positive or negative. So that was critical. And then with our pool testing, we did over 20,000 tests last year. Again, our nursing staff was incredible. They had it down to a science, and kids were out of the classroom for seconds and got right back into the classroom. So there wasn't it didn't impact instruction at all. So it allowed us to have a surveillance-based testing so we could see if the virus was in our schools, and we could act very quickly when we found it. Then DESE and the Executive Office of Health and Human Services will continue to offer these services at no cost to district. So that was the key piece last year. There were other districts that had done some fundraising and had done some work on getting pool testing earlier than we did. However, the state had indicated fairly early they were going to support us up until a certain point, and they ended up paying for it the entire school year. And they have now honored that again for the next school year. And they actually honored it through the summer if we wanted to do it during the summer as well. So they've really stepped up in that regard. It's not cheap to do this, and they've actually offered additional assistance with staffing as well this year. So we're going to try to see if we can take them up on that and get additional staffing to help out on those pool testing days. We're looking at doing pool testing throughout the entire school district. We're looking at K-12 at this point. We're not sure about preschool, but we're definitely looking at K-12, and partly because we're going to be having students that are going to be eating lunch without their mask on in the cafeteria. So we want to make sure that we're able to do the surveillance testing to make sure that we don't have any viruses in our district. So in terms of the back to school guidance around protocols, there's a new test and stay program, which will allow asymptomatic close contacts to remain in school, participate in sports and extracurriculars as long as they take a rapid antigen test daily, which is the Buy Next Now. Wear a mask and follow the other guidelines noted in the documents. This is a really important piece. So no longer are we going to have students that are a close contact where they have to leave school and be out of school for either 8, 7, 10, whatever days. It changed during the school year, but it allows kids to stay in school as long as they're taking that test for 5 days in a row and they remain negative. If districts do not have a test and stay available, or individual or family chooses not to participate, a close contact will need to quarantine at home for at least 7 days from the point of exposure. So that's the response if you don't want to participate in the test and stay, which we will do as a district, or if a family chooses, then it would be 7 days of quarantine. Districts and schools may continue to test students with mild symptoms with the Buy Next Now test if available. So long as they are tested negative, individuals with mild symptoms should remain in school. Really important. The goal here is to keep our kids in school. This does that. The list of close contacts who do not need to participate in testing and quarantine protocols has been updated to include individuals on school buses when students are masked, windows are open regardless of distancing. So if you remember, last year we had a couple of cases where we had a student who tested positive, and then there were many students around that person that rode the bus with them, not necessarily in that student's class, but rode the bus to and from school. They also had to quarantine. That is no longer part of the protocols. There's been research on, again, having the open windows and the masking on the buses that really prevents the spread. So that's more good news for kids not having to be out of school based on those two factors of keeping the windows open and the mitigation factor of wearing a mask. So that's a quick overview, and I just want to reiterate kind of what Jess had said earlier. This is really critical, your feedback. It's really important to us. We have another week now that we're working on operational issues, but your feedback is critical. I ask that you limit your feedback and comment to the guidance that we talked about tonight, and that I also sent home to you last week in an email, because the operational issues, we're still working on those, and they may change based on what the vote is next week. So any operational issues like what are you going to do if, that's a little bit different from the guidance. So I'd ask that you keep it to the guidance so that we can take notes and we can get all that information and really make an informed decision and vote next week. So thank you. That's all I have there, Madam Chair.
Thank you, Dr. Marsden. I very much appreciate it. And so with that, I do want to make people mindful that we have at this point about 156 attendees in the attendee list, which I suspect means that there are either a lot of people watching other people talk, or there are a lot of people who want to talk. So with that in mind, I will now open the floor to parent input, and I'm going to ask you to use the raise your hand icon to indicate that you would like to comment. And this is the first time that I reiterate that we will listen and take notes, but there is no debate here tonight. And the statements of all commenters should be evaluated through a trusted source before they inform your views as well. At 2 minutes, I'm going to ask you to kind of wrap up your thoughts. And no comment should be longer than 3 minutes in total. And I'll try to do a good job of keeping an eyeball on that, but I want to make sure that I'm also listening to what you're saying as well. And if we ask a clarifying question, which the committee will ask to do so, I'll use my best judgment in terms of time, but this is not like a buyback kind of time thing. We'll try to keep it pretty succinct so as many people can say what they want to. Okay, so if anyone has a comment at this point, please raise your hand. All right, who do I see here? Let's go for Marla Beck. I'm going to allow you to talk. Yep. All right. Marla, if you could turn on your video, please.
Oh, hold on.
And Marla, do you have children in the school?
I do.
Okay.
I don't know if I've turned on the video or not.
Not quite yet, but I don't have my glasses on, but it looks
Okay.
a little like a Santa costume.
Yes, and that's weird because that's not me. I have no idea how that's even there.
Okay. Well, Marla,
okay.
I appreciate the effort. Give me a.
Can I
give me your
talk anyway?
comment, please. Yes, please. Go ahead.
Okay, so yes, I have 2 kids. I have one at Dale and one in the middle school.
Okay.
So my concerns are the fact that masks will be required in the elementary school. However, masks won't be required in the middle school. So whether you are vaccinated or unvaccinated, because the high transmission rate with the Delta variant, even if you've been vaccinated, you can still pass the pass COVID, right? And so you're bringing it home to children who are not vaccinated nor can get vaccinated because of their age limits. So I have concerns about that. I'd prefer masks across the board. But on top of that, I have heard other school systems starting the school year with 3 weeks, 2 or 3 weeks of fully masking everywhere because people travel a lot in the summer. And then if that's something that you're going to take into consideration, I would also prefer that to be around the school year, the school vacation timeframes, if not requiring masks for the middle school and the high school for people who are vaccinated. I think that there should be definitely around the school vacation timeframe when people come back, because they're going to be on planes, they're traveling to who knows where, and it's just more exposure. So that was just a thought that I had.
Okay. Thank you.
But I'd prefer masks across the board.
Right. Thank you, Marla. I very much appreciate that.
Thank you.
Okay. The next, if I do something terrible to you, I'm sorry, Marla. How about the next person, Kristen Morse? I'm bringing you over, and if you can turn on your video, I'd much appreciate it. Although pictures of Santa are charming too. Kristen, are you there? Kristen?
Can you hear us?
Yes, I can hear you now. Yep.
There's no video option to turn on, or we would.
Okay.
But we had a clarifying question because I don't think
Can I ask your name, because you have a very deep voice?
Sorry. Doesn't sound like Kristen. This would be Russell Morse, her husband.
Okay, thanks, Russell.
Her Zoom account. Thanks for the presentation. I appreciate all the information. I did have a clarifying question.
And our daughter's going in Wheelock.
Okay, great. Thank you.
So if I missed it, my apologies, but for the plexiglass and the distancing, are they going to be in effect? I believe there's no distancing anymore, but I wasn't clear on the plexiglass around the desks and stuff.
And I think also just, you know, a big thing, we have a daughter who's going into second grade. So we felt like last year she missed out a bit on having the group activities, sitting at tables, really being with her peers. So I think we're in support because they are masked, of bringing that back and having the ability to, you know, go to the cafeteria, go to art class, being able to, you know, sit at a table and do those small group work without that social distancing piece. That's something that we feel is important from a social emotional development standpoint.
Back to normalcy as possible.
So that's something that we feel strongly about.
Okay, thank
So
you.
is there any, can you clarify on that? Whether, if you have that information about the plexiglass or you don't know?
That's another one of those kind of operational questions that
okay.
we will come out with when we do come up with our plan.
Okay.
You know, it's not recommended this year, but again, it's an operational thing, but we will take care of it.
And one other clarifying question we had is just, I'm assuming teachers K through 6 are not masked, but our students are. So I guess just, I don't have a strong opinion on it, but I guess just what the clarifying question is, will those teachers be masked, or the plan is for them to be unmasked?
So the guidance says that if
Vaccinated, designated.
an adult is unvaccinated.
They won't be masked. Okay.
Okay, thank you.
Thank you.
Okay. All right. So may I then bring over Sarah Kashan-Lu?
Here we go. Can you hear me?
I can. Thank you, Sarah. Sarah, can you, do you have a video ability or?
I don't see one. Let me just look around 1 second. I don't. I have a mute and unmute, and I don't have a video ability. I apologize.
No, it's interesting. I've never quite run into this problem before, but go ahead, please. Thank you.
So my name is Sarah. I have 2 kids, one at Wheelock and one at Memorial. I'm a pediatrician at one of the local hospitals here, and I'm also here to speak in support of universal masking. The CDC and the AAP both put out guidance towards the end of July that supported universal masking in K through 12 for teachers, staff, and students, regardless of vaccination status. And that was because that was in response to the Delta surging and the fact that vaccinated people can transmit Delta to unvaccinated people. And even though the vaccination is a best protection and vaccinated folks transmit Delta for much less time than unvaccinated folks, it's still a risk. And I'm particularly worried about sort of unmasked teachers potentially exposing the children or older siblings in high school, exposing their younger siblings at home, even if they themselves don't get sick. I think that there was so much fear and so much uncertainty when this all started 18 months ago. I so distinctly recall the day when we got our kids back and then thought they were going in the next day. And then they just didn't for a very long time. And I don't think remote learning was really ideal for anybody. And so I'm so excited for my kids to go in and to stay in school. And I think that we should use the measures that we have available to us to keep schools open. I think looking at the South, you guys have probably read about how the hospitals are full and they're running out of beds and the pediatric units are full and there's no ICU beds. And the situation.
This is not personal, Sarah, but I'm going to tell you to start to
Wrap up.
We're at 2 minutes. So
Sounds good. We don't have a lot of hospital beds left either. So I would promote universal masking from K to 12 for everybody. I think that will be our best chance at keeping our kids in school.
okay. Thank you, Sarah. I very much appreciate it. Okay. I have a Sarah S. And Sarah S., please let me know your full name. And as soon as you come over and turn on your, and I'm gonna.
Can you hear me?
I can hear you now.
Hi, so this is Sarah Sokolowski.
I thought it might be. Hi, Sarah.
Hi, and I also don't see a video button, so I will, I guess, just go ahead and.
You go ahead.
So we have 4 kids in the Medfield public school system, 2 at the middle school, 1 going to Dale Street, and our youngest is going to be going to the integrated program at Memorial starting, actually he was there this summer, but he'll be going full-time in the fall. And my questions are more focused on the youngest learners, so the kids at Memorial and specifically the kids that are in the integrated program. And I know that this presentation focused mostly on K through 12, but I do believe that one of the previous emails mentioned pre-K, masking policies for pre-K, and because these students are going to be at Memorial with the kindergarten first graders, I'm assuming that there will be policies provided for those students too. So my perspective, I think is a little bit different than the people that have spoken up so far, in that my son is on an IEP and has been without in-person services for 18 months. He was part of an early intervention program that was remote. And as you can imagine, a remote Zoom therapy for a 2-year-old is basically non-existent. So we've been really excited for integrated. He did the summer program and it was amazing. The Medfield teachers and therapists were awesome. And we had the best experience, and I saw changes like in a 5-week program. So it was amazing. And we're so looking forward to it. And I think in person, seeing faces, especially for speech development, he's got a speech delay. It was like a material change. And so I'm like pleading that there are either exceptions, and I come from a perspective where I think that just general development for kids, the youngest learners, they learn a lot from facial cues. And we've seen this in real life, that he is benefiting from these services that are in person. And I think seeing facial cues and mouths is so important, especially in speech development, so in speech therapy. So I guess that's my opinion, and I would like some more guidance just on the integrated program and the policies that are sort of on the table and being talked about and weighed, and what's going to happen for students who may not be able to meet the expectation if masks are mandated, which it seems like that probably will be the case, because I know my son won't wear one right now, and maybe he'll get to a point where he will, because I really believe that these therapies work, and but right now he won't. And it would be really crushing for him to not receive the services that he needs and deserves to thrive in an environment with students his age. So and we're making, as a side note, less important, but like childcare decisions. Now my husband and I work full time, so we're making childcare plans based on him being integrated from 9 to 2. But if I get a call that he can't attend because he won't wear a mask, like these are just things, these are unknowns to me. So I would just like I would like some guidance. And I know that we don't know all the answers. Like we don't know the policies yet because they haven't been decided, but I personally need help making these decisions because I work full time. So if I get a call that he needs to be picked up, well, now not only is he not getting services, but I have a childcare issue too. So
I
this
hear
is
you,
not
Sarah.
like a woe, it's not a woe is me,
No.
but just like, these are the things that I'm thinking about and trying to navigate in like the next 2 weeks.
Yeah.
So I would just, really love some guidance on what we're thinking about for these students in the integrated program, and especially the ones that are on IEPs and may not be able to meet the expectations that the other kids are held to.
If I may, Madam Chair, Sarah, thank you for that information. I would encourage you a couple of things to talk to Dr. Billsborough, the principal at Memorial School. I think she'll be able to help you out with that. And I know that the nurses and the principals have worked with students that need, additional supports around that area with masking. So that shouldn't be an issue if you reach out. And then the only reason why the guidance that came out in DESE is K to 12 and not pre-K to 12 is bureaucratic, is because preschool falls under the Department of Early Childhood and not under DESE. So that's the only reason why it's not there. So whatever we implement for Memorial, it would be school-wide. It wouldn't just be K and 1.
Yeah, so I guess that's sort of, so how are, I and we can, I'd love a conversation offline too, but how are we working with these kids who are going to struggle with that?
Yeah, so
and how are they
Sarah.
supported?
So Sarah, I can assure you, we did it this past year with students, so I think it'll work out. If you can reach out to Missy, I'm sure she'll be able to help you out with that.
Right.
Okay, thank you.
And Sarah, if you'd like to have an over the fence conversation, I'd be happy to do it with you at some point.
Okay.
Too, okay. Seriously.
Thank you.
You bet. Okay. Do I have anyone else? If you'd like to raise your hand. Anyone? Any thoughts, questions? Kate. Okay. Kate. I'm gonna bring you over. And again, if you could tell us your name when you come over. Clearly, for whatever reason, the video is not working today. Not quite sure why, but it must be a setting issue that we weren't aware of. We have a different host than usual. So, Kate, if you would like to go ahead and just tell me your
Sure.
name, please.
I am Kate Landers,
Okay. Hi, Kate.
and hi. We have a son in it's going to be starting at Dale. And I just wanted to first thank you guys for your tremendous efforts that you had put in last year. I was blown away by how methodical you were in making every single decision that you made. You guys had to make, plans for reopening that were just 3 whole separate plans, and then you had to revise your plans and things got changed last minute. And I felt that we were in cohort D, and I thought that it was extraordinary. Even for some children on IEPs and 504s, it was an incredibly wonderful experience, much to our surprise. And I think you guys did a phenomenal job with that program. And from what I have heard, your program for hybrid and then later fully in person, you also took every possible opportunity and length to make sure that the kids were safe. And I have heard nothing but great things about how you managed last year. And I know that a lot of you are volunteering your time. And I just want to say thank you for loving our kids and really looking out for their well-being and their safety last year. I really appreciate that. And when it comes to this year, I have the same confidence that you guys will do the same thing. And I am optimistic that you guys will again put all that same amount of effort in, which is unbelievably, I just can't believe it's being asked of you guys again, especially with the Delta variant. I would request that the guidance from the CDC be followed, which basically would be the universal masking for teachers as well as for basically anyone ages 2 and up in school buildings. And also, and I know there's a lot of reports, a lot of great guidance on that. I know that Dr. Anthony Fauci had recently come out and saying that, you know, Delta is a new virus. This is much more contagious, or it spreads much more quickly and widely. And for that reason, I would hope that there would be the universal masking. I also would hope that the cafeteria is the one area of real big concern for me. And I know it's not just me, but I would love to know. I think that's great, they're eating in the cafeteria, but I know there's no social distancing, and that gives me like a panic attack. So can you clarify? I know you guys are going to come out with your plan in a week, but if the kids are not going to be spaced out during lunch, my concern is that we may not be able to put our child in school safely. And so I'm just wondering if there was a way that you did lunch last spring that you're just going to continue. If there's anything on, I know they're not doing social distancing, but any guidance on the cafeteria, I would really appreciate. I don't know if I could make it another week waiting. And I'm done.
Okay,
Thank you.
great. Thank you very much. I appreciate it. Okay. I see Marla may have raised her hand, but there's Jackie Corrigan. So I'm going to let Jackie go first. I'm going to, okay. Jackie Corrigan, I'm going to bring you over.
Hi,
Jackie, hi, how are you?
good. How are you?
Good, thanks.
So I just wanted to say that masking kids is irrational and unscientific. There are significant mental health implications of masking children, along with social distancing and constant reminders of danger. The psychological damage we're doing to kids is irreversible. They are being raised in fear of each other, fear of the world, fear of illnesses, viruses, and even the air they breathe. They're being taught to fear everything. Prolonged fear is terror, and terror becomes trauma. Masks harm their mental health. Besides accidents and cancer, suicide is the leading cause of death in children. Suicide kills 10 times more than COVID has. This experiment children have been forced to participate in without their consent is causing irreparable harm and is potentially very dangerous. Face masks were designed to be worn in hospitals to prevent saliva droplets from landing on patients and fellow staff. Children are required to wear this medical device for 8 hours a day, 5 days a week, even while participating in physical activity, without the due diligence of a single scientific study to determine if it's safe for children to even wear them. Until there is scientific evidence demonstrating that wearing masks for this extended period of time causes no harm, wearing masks should be left to the discretion of the individual and should not be required or mandated, especially not for children. What is
Okay,
right,
Jackie, you have one more minute, okay? Thank
Fine.
you.
What is right for you may not be right for me. What is right for me may not be right for you. What is not right for either of us is being stripped of freedom to choose what is right for ourselves. Children are not the drivers of the pandemic, so stop putting the burden on them. For the sake of the kids' immediate and long-term mental health, it is time to put their needs first. Do not force them to wear masks. Thank you.
Thank you, Jackie. Appreciate it. Okay. So the next person I'm going to bring over is Mary Beth Reddy. So there you are. Okay, Mary Beth, feel free.
Hi, can you hear me?
Yes, we can. Thank you.
Okay, great, thank you. I've lived in town since 1996. I have 2 children that are now in the school, 2 that are in college. I will have a high school senior and I will have a high school freshman. And Jackie just brought up some really excellent points that I feel like have not been touched upon, is the mental health of our children. And I strongly believe that we should follow the DESE guidance, that if someone is vaccinated, they should not have to wear a mask. We have high percentage of vaccinated staff and students in this town. We have had very low COVID rates. Now, whether that's because we got hit early and hard before we really knew what COVID was, or because people have done the right thing, which I know many kids and adults in this town have made decisions that have enabled our town to have very low transmission rates. We went out, we got vaccinated. I will be very upset if our kids and our students who have chosen to get vaccinated have to mask because of the fears of people with, you know, younger kids, where it's been shown that younger kids have very lower issues with COVID and transmit at much lower rates. Vaccinated people have been shown to possibly transmit, but at much lower rates. And with our pool testing, we are going to have a grasp on what is going on in our schools. We know that the transmission in schools was very low even before we had vaccines available to anybody. We had very low rates throughout the whole fall, winter, and spring. And any cases were not transmitted in school. And we can ask Kathy Thompson this, but the transmissions seem to occur outside of school where people were not wearing masks. These students are getting together on a social level, and I just think it would be wrong if we take the DESE guidance and just say, nope, we're going to mask everybody universally. I don't agree with that. I think we need to look out for our children's mental health, and I really hope that we can at least have an off-ramp too for these young kids if we are going to have no vaccine for them, because there is no guarantee that there is going to be a vaccine that will be approved this school year. So is there an off-ramp for those children where we can say, we're not seeing transmission in school, we're not seeing cases, and give them the opportunity to possibly drop the masks as well? Because I do believe that the social implications and the learning to read and hear and be with their peers and see faces and not have the fear is something that we have to consider, and please keep in mind. Thank you.
Thank you, Mary Beth. I appreciate it.
Jess, can I ask Mary Beth a follow-up question? Hey, Mary Beth, I was just wondering, you said you had 2 in college, and just out of my own curiosity, have you received word whether your 2 college-age kids will be wearing masks while they attend classes?
So my daughter is going to be a senior at Elon University in North Carolina, and they had a vaccine mandate for students, but just recently, within the last, I think, week or so, they have come out and said that in classrooms and office buildings on campus, they do need to wear masks. My son goes to Xavier University in Ohio. They did not have a vaccine mandate, but they did just come out in the past couple of weeks and say in classrooms, they wanted them to wear masks, and they did not need to wear masks, however, in their dorm rooms. And they did not need to wear masks in common areas of their dorms. But on that note, one thing that Governor Baker has said, and I completely agree with him on this, is that Massachusetts is in a very different position than the rest of the country. I understand that the South is in a different situation, but we shouldn't base our policies on things that are going on in other states that have much lower vaccination rates. So for instance, Ohio has a much lower vaccination rate than Massachusetts, so does North Carolina. Right. So we should not be basing our decisions on other states and what has happened with them. Okay. And on another note, which I think is great that the schools are doing.
I'm going to cut you off in about 15 seconds. So
ventilation, Dr. Joseph Allen of Harvard, he is strongly proposing increased ventilation as the #1 thing to prevent transmission. And we've done an amazing job in our schools at that. So keep that up. Ventilation is key. And like I said,
thank you, Mary Beth.
Have a normal school year. Thank you.
I appreciate it. Thank you.
Thanks.
Okay, Meredith Flannery, please. Let's see, allow to talk. There you go. That's what that does. Okay. I can hear you. You're a little scratchy.
Okay, I think it's my connection. Hi, I am Meredith Flannery.
Much better, thank you.
New to town, and my son will be entering Dale Street School. Like some others have stated, very impressed with the measures put in place last year. I joined the Zoom session before school began last year, before we had even decided to move out of Boston to here, and was incredibly amazed by just all the steps put in place and resources and attention to detail to make it a safe rollout and to even go hybrid and then go full person. Incredibly impressive from my standpoint. Last week's meeting, I thought it was a really interesting point that was raised, that we're going off of a lot of alpha data based information. It's still early in the game with Delta, and we don't know yet. And the risk socially and mentally is of great concern all around. I do feel that more importantly is the opportunity to be in person, to be in school rather than remote learning, which I found to be detrimental, like many other households. So I think that it's more important to have universal masking than to have any hybrid type learning or remote learning. I know we're planning on in school. Also, I think it's unknown how much what the rate is around our state, as we're not in school yet. The southern states have started their year, so they have more data to go off of. We're still vacationing, and more people were home last summer, and let's hope safety measures have been in place, but there's been a lot more room for, choosing what you do without mandates in place. Again, I think that the best plan is to be in school with masks for everybody. Also because the children, not only if there's more than one kid in age group in school, one vaccinated, one unvaccinated, they could expose each other, plus anyone else in their, excuse me, 1 minute, Sienna. Anyone else in their family or extended unit that is vulnerable, which I can speak to. And that's, we'd like to keep those people in our little bubble, even our 97.5-year-old great-grandfather fighting cancer right now. These people all matter, and it's a small ask, in my opinion, and a really unbelievable, unfortunate, but important lesson in resiliency to step up and mask and protect each other. It's the least we can do, I think. And I just appreciate you listening. I think it is difficult we're not going to find consensus here, but I think it's better to start with tough measures in place. You're already pulling back on plexiglass, and possibly we'll find out from operations. Distancing is going away. I like the idea of more interaction and opportunity. That's part of why we moved here. But I think it's easier to put in place the measures and then reduce them as we do have more data to go off of, but harder to level up and get people on board. So I would rather absolutely want to see I would like to see everybody masked, and it's not to, it's to best take care of each other, ourselves, the children, and everyone they come in contact with. Thank you very much.
Thank you, Meredith, and welcome to town.
Thanks.
Marla, can you please tell me if I have simply not put your hand down, or if I lower your hand, please let me know if by raising your hand again, if you actually want to talk, or if I just didn't lower it for you. So I do have Sylvia. If you can come over and please let us know your full name.
Hi,
Hi, my name is Sylvia Cooper, and we are new to town. I have two boys. One will be entering Dale Street, and the other will be attending Wheelock. And I just really wanted to piggyback off of what one of the other mothers said, that one of the things that's making me really nervous, sounds like there are a lot of mitigation efforts that are being put into place, which are great with the ventilation, and hopefully masks will be mandated and necessary and enforced. But I'm concerned about the cafeteria situation, and that's causing me a lot of anxiety as well. And I guess, especially since I'm new, I can't picture how all the kids will be sitting in a cafeteria eating, like if they'll be close to one another or if there'll be social distancing. And any clarity or any more information about how lunch will be handled would be so appreciated. So that was just my only question or comment to the committee.
Thank you. Thank you, Sylvia. I really
Thank you.
appreciate it. And
Thanks.
welcome to town as well.
Thank you.
Okay. Okay, so the next person I will bring over is Stacy Palmer, and then Marla, I'll bring you back over at that point after that. Okay, Stacy, can you hear us?
I have to unmute myself. Hi, I'm Stacy Palmer. I have 3 kids, one in Wheelock and one in Dale. My other one is not yet in school. So I think I just wanted to comment that we've learned so much about the virus over the last 18 months or so, and what works and what doesn't work in terms of preventing transmission. We also have testing now that we didn't have at the start of last school year. We have obviously vaccines, and our town has really stepped up and vaccinated at an incredibly high rate. I just request that we really think critically and take sensible measures that actually work. I think there are some measures that we put in place last year that weren't particularly effective at preventing the transmission of the virus, but maybe made us feel good. So things like the plexiglass barriers, the constant cleaning, they don't really do a lot to prevent the transmission, but are sort of a metaphorical barrier to normalcy for our kids. I actually heard a lot of concerns and complaints about the plexiglass in particular. And so I'd like the measures that we do put in place, just be really thoughtful about what actually is going to work with the transmission of the virus. And then secondly, I'd like to strongly advocate for things like field trips, group projects, band and chorus, and other events that were eliminated last year that are so important for our kids as part of their education and their general childhood experience. They've missed out on so much in the last year and a half, and I'd like to see some of these things return so that we can start to bring some normalcy to our kids again. Thank you.
Thank you, Stacy. Very much appreciated. Okay, Marla, I'm going to bring you back over. All right.
Okay, can you hear me?
I can hear you, and I can see Santa.
Yeah, that's really weird. Okay. My question was this: do you actually have the percentage of students in the middle school and the high school that are vaccinated? Do we know that? So that was one question. And then the next was, have you actually had feedback sessions with students who maybe are not vaccinated? Would they actually wear a mask if their friends who are vaccinated are not required to? Because I actually have had those conversations with my daughter, and she said she wouldn't wear one. So we got her we got her vaccinated. But I mean, to have blunt conversations, I just want to pass that along. A 13, 14, 15-year-old, if your friends are not wearing a mask, they're not going to want to. So if you make it optional, I just don't see it. I don't see it working well.
Okay.
I'm for universal masking. I have a kid in a lower school who can't get vaccinated, and I have a kid who's in an upper school that can.
Okay.
It's just, so my question though is about, do you know the percentages of students that are vaccinated versus unvaccinated?
We do, and it's very high. And we
Are
can
you gonna actually put that out there?
I think when we deliberate next week, we will definitely bring that into the conversation. It's not an enormous secret. I think it's actually on the Board of Health
Yeah, I wasn't sure where it was.
discussion that we did. And I think, and Kathy, correct me if I'm wrong, but I know at the high school, it's about 94%. At the middle school, currently in 7th and 8th, it's about 84. And a lot of those kids are just waiting on second doses. But
Okay.
I'm going to keep going. Thank you, Marla. I appreciate your comment, and it's valuable to us. I want to let you know that. Thanks.
Thank you.
And so the next person I'm going to bring over is somebody I suspect is Andrea Sullivan. But if I am wrong, you will certainly let me know. There you go. Andrea, are you there? Assuming it's Andrea?
Jess, it's definitely me. How are
It's
you?
like I'm psychic. I am great. How are you? Go right ahead.
Okay, well, I'd like to start with a couple of facts first off, and ask a question. I was on the Board of Health call the other day where, and I'm going to share this information because others might not be aware of it. We were told that 85% of people in Medfield are vaccinated and 93% of Medfield school staff. I'd also like to remind people that people in the 0 to 19 years category are 99.997% able to recover from COVID. 20 to 49 years, 99.98%. 50 to 69 years, 99.5%, and 70 plus years,
Andrea?
94.6.
Can
Yes.
you talk to us about how you're feeling specifically about the
Yep.
guidance?
I'm
Thank you.
getting to that. Yep. I just want to make sure everybody's clear on my point, Jess. And the reason I bring that point up is that is actually a CDC chart. So the question about whether or not to vaccinate kids for something that has less than a 0.1% kill rate is something that should be considered by parents. But that is not the topic of conversation. So what I would like to also bring up is the fact that in the conversation with the Board of Health, I asked the question to Steve Rush whether or not there was an independent peer-reviewed scientific study looking for the efficacy of mask wearing in preventing COVID spread. And on the call, he stated clearly that there was not. So the decisions that we're making are not based on any kind of scientific fact, despite the fact that on this call, we are looking for that information. I did and was able to dig up some information from the CDC back in May of 2020 called the Non-Pharmaceutical Measures for Pandemic Influenza in Non-Healthcare Settings for Personal Protective and Environmental Measures, in which it said in pooled analysis, this is a quote, "We found no significant reduction in influenza transmission with the use of face masks." In addition, I will further quote on the same study that it says disposable medical masks, also known as surgical masks, are loose-fitting devices that were designed to be worn by medical personnel to protect accidental contamination of patient wounds and to protect the wearer against splashes of sprays or bodily fluids. There is limited evidence for their effectiveness in preventing influenza virus transmission, either when worn by the infected person for source control or when worn by uninfected persons to reduce exposure. Our systematic review found no significant effect of face masks on transmission of laboratory confirmed influenza. Now that is specific to influenza. However, I would like to point out that's what we have. That's an actual scientific study that was done, peer reviewed. I would also like to point out that I agree with several people that were on the call, namely Jackie Corrigan, and the mental health concerns that she has around mask wearing, the concerns that I have around saying that only certain pools of people, unvaccinated in particular, especially in the middle and high school.
We're
where
at,
they're making
about 2 minutes, 30 seconds.
Great, thanks.
Thanks.
We're having, peer pressure involved in being masked, and some kids that have anxiety where this might be a really difficult thing. In addition to having a child personally who has a hearing disability, where learning is a struggle to begin with, no less having people's faces covered. I also agree with Stacy Palmer regarding field trips because I think the kids have missed out on a lot. And let's see. I would like to see if there's going to be a survey on the kid and to parents before school, before you guys make a decision on how many kids by school or by grade will actually be willing to wear masks. Because I'm hearing a lot of people who are saying that even if their kids are vaxxed, that they're going to want them to wear masks, and it would make my child feel better to know they're not alone.
Thank you. Appreciate it, Andrea.
Yep. Thanks for the time.
Okay. You bet. Sorry, I had to cut you off. Okay, let me see. Let's go to Melanie Winfrey. You go, Melanie. And sure. And I actually just want to remind folks that we want to really speak from our own personal perspective and not kind of be bringing other people into it. I'd really like to hear, and this is not a specific comment on Andrea, but I'd really like just to hear your specific thoughts on the guidance as is presented now. Okay, so thank you, Melanie. Go ahead.
I have a rising sixth grader and another one going into Wheelock this year. Our household would much prefer that we do 100% masking to ensure that we are able to continue to stay in school right straight through, as the team did such a wonderful job this past spring. I also had a question around the air filtration. I think it's great that we've improved our MERV levels to 13 and 8 in the schools that we have HVAC systems in. I'm wondering if there is any ongoing work to bring a MERV 17 or above, AKA a HEPA level filtration, into those spaces so that they're getting the higher particle filtration available if we were to move to what is a HEPA level filter, which sounds like what we've done in the grades that don't have HVAC systems.
Okay. All right. Thank you, Melanie. Is that the extent of your comment?
Yep, I'm good.
Great. Thank you.
Thank you.
Okay. Let's see. Let's go for Matt Costello. And, actually, if I could ask one of the committee members who happens to be a co-host to help people or to take hands down after I'm done, because it's a kind of multiple function. It would be easier if somebody would do that. Okay, so I'm going to bring Matt Costello over. Come on over, Matt.
Okay, can you hear me okay?
I can certainly hear you.
Okay, so I'll state what my case is regarding the guidance and then backfill. I'm honestly against masking. And I would base that regardless of the age, so whether it's K through 12, K through 6 or 5, young kids, old kids, and, frankly, also based on the vaccination status, which I know not likely going to see any change in that right as we enter into school, but I'm asking parents to have an open mind based on a couple things. First off, there's been a lot of discussions about the potential
I don't want to
mental health
interrupt,
issues.
but can you tell us what grade your kids are in?
So I have a middle schooler, 8th grade rising, and the rising senior.
And a senior?
Yes.
Okay, sorry. I'm sorry for interrupting.
No, that's okay. So, obviously there's been discussions about the potential mental health issues, also physical health issues. There were studies done showing oxygen deprivation, high degrees of CO2 in the blood, which could lead to actual physical illness. And I think one of the things we need to think about for the kids is right now, many of us are choosing our fears. And of course, we're fearful that our kids, God forbid, could get really sick and pass away. But at the same time, maybe we're missing out on the potential ramifications, 5 and 10 years down the road. And so, looking at that, since COVID began nationwide, 350 kids have died from COVID. John Hopkins did a study and found that of those 350, I think it was like 347, that all of them had underlying health conditions. And so not one of them was actually healthy. Now, during that same time frame, all cause of deaths for children during this period of time, 57,000. My concern is we are asking our kids to carry a disproportionate burden for the risk that this virus actually poses to them. And frankly, the risk that they pose to others. They have not been a source of spread. And to piggyback on some of the mask discussions, because I did say I'm against it across the board. What we now know, and it's been admitted by the CDC, vaccinated can get and transmit Delta. Their viral load is just as high as the unvaccinated. They are just as likely to spread COVID as an unvaccinated person. So there's no difference in spread. The only difference right now is the severity of the illness the actual illness that you experience, but the spread is not any less for a vaccinated person. You know, when you
Matt, I'm
look
going
at
to
that,
ask you to start wrapping it up.
Yep. What I'm gonna say is I think there's a couple things we need to look at. The first is that we need to look to Israel and the UK. They've had Delta before we have. That's going to put a lot more perspective on what the true mortality is, and also a better sense as to what we can do for treatment. But I'll just finish with, I think we are underestimating the impact of our kids, and we're asking and putting too much on their shoulders, and we could really rue that decision down the road.
Okay, thank you, Matt. Much appreciated, truly.
Yeah, thanks.
Okay, lower hand. And I'm trying to see. So the next person to come over who has not spoken yet is Lauren Liljegren. I'm going to bring you over, Lauren. There you go. Oh, Lauren has some sort of picture thing there. Great. Hi, Lauren. You can start when you'd like to.
Sorry, I was muted. Okay. Thank you so much for the opportunity. I firmly believe every family should have the supported choice to send their child to school with a mask every day and be supported in that choice or not. Children are the least likely to transmit this respiratory infection and the least likely to suffer negative health outcomes if they do contract the virus. Yet, for the last 18 months, our most vulnerable population has experienced restrictions, limitations, and cancellations. Our children should experience the most freedom, the most support, the most normalcy while they develop. Childhood does not offer a do-over. Are we mandating school employees and other adults who will come into contact with our children to receive the vaccine? Restricting children should be the last tool in the toolkit that we use. Adults should take this burden from children. Medical research resources have been spent studying COVID as they should be, and the consequences of mask wearing are real, varied across age group, and in some cases severe. It's parents who will be expected and will manage the consequences resulting from the policy choices this committee makes. Deficits in speech, social skills, facial expression decoding can and do require long-term specialized therapy. Risk tolerance and priorities vary among families, and our policies should reflect this. If you do choose to mandate masking for all, please document and communicate what circumstances will need to present for the committee to remove the mandate. We need to know when to stop before we start. Please ensure that those measurable, achievable circumstances are documented in any bargaining agreements you sign. Please give our children the ability to experience any mask-free days they can. And please do not create a contract forcing our children to wear masks one day longer than they have to. Thank you.
Thank you, Lauren. Okay, so the two people I have left, what I'd really like to do is see if there are people out there who have not spoken yet. Did P. Crowley speak yet? I'm sorry, I'm starting to lose. Do we know? No? Oh, wait, they're gone. Okay, so at this point, I think that we probably want to make sure that we're keeping comments to only 2 times, if you feel like kind of coming through, and then otherwise, please use the comment line as we, or the comment form. So Jill Frederoli is here and she has not spoken yet. Then I will go to Andrea Sullivan and Sarah Kachin-Liu. There you go. Hi, Jill.
Hi there. Thanks for giving me the opportunity to talk. I have 3 children currently in the school system, 1 going into Wheelock and 2 that will be entering Blake this year. I just want to say to start, I'm in full support of masking all individuals, whether vaccinated or not. I am confused at the all of the references to the previous history that we have about COVID and things that were or were not successful, risks that did or did not exist. Everything you read says that the Delta variant is extremely different, does not care if you're vaccinated or not. You can still be infected, you can still pass it along. So that is one thing that's highly concerning to me. I have a son that was just diagnosed with an autoimmune disease, and he's going into Blake, and I am a full supporter of in-person learning. I have seen the huge difference that it made in my children when they went back to school. But in order for me to feel safe sending my child to school, that means that people need to be masked. And while I hear other risks about mental health, I don't think that we can put aside the physical health risks that are associated with this and all those that have those type of situations that we need to think about. And I don't understand why a little sacrifice in one person is not being made for the greater good. I also am a little confused, and perhaps I just need to do more research, but I'm trying to understand what that means for a school like Blake, where the requirement for a 6th grader is to be masked if you are unvaccinated, but the requirement for 7th and 8th would not currently mandate a mask if you're vaccinated, yet as I stated, you can still carry and pass it along. So I'm not familiar enough with the school. I have a tour next Monday, but I'm not understanding how, if they would be restricted to certain areas of the school or how that works. I'm terrified of what the cafeteria would do in terms of posing risk to my child if there's no safety measures put into place. So, you know, forgive me for my ignorance in some of this. This is a very new diagnosis that my family and I are trying to get our arms around, and we just want to keep our child safe and be able to send him to school. So I just wanted to make sure that I spoke up. There were so many other points made tonight that I was in agreement with. Kate Landers had some really great points. I believe Meredith did as well. There were several people that really already echoed Melanie Winfrey things that I'm thinking. So I will not repeat all of those things, but I am in full support of masks regardless of vaccination status.
Thank you, Jill. I appreciate it. Thanks very much. Okay. Oh, sorry, Andrea, I just lowered your hand. This is a little complex over here. Okay, so I'm going to have, I'm sorry, Andrea Sullivan, if you could raise your hand again, that's great. But I'm going to have Sarah, Cash and Lou come over, and then we'll have Andy. And there are 2 people who cannot really readily be identified by their names. So it'd be very helpful if you could fill those in. But I will have Sarah come over, and then I think it would be very helpful if we could have commenters who only comment once, and that we're not kind of going back over and over again. And please use the comment form to make that to make those comments. Okay, thank you. I promise we will read every single one of these. Thank you. Okay, Sarah, come on over.
Thanks so much for having me. I just wanted to talk about a couple points that I've heard people make throughout the conversations. So
Sarah, hold on. Yeah. I think we really are trying to get to make sure that this is a reflection entirely on your experience around your understanding of the guidance and back in that way. But I kind of one of the great kind of the thing that we would really like to do with this is to make sure that it is about your understanding and not kind of get into the, I really support this person, I really support that one. And I know it's difficult not to do. But do you have some other thoughts on the guidance that you were unable to express before?
Yes, I do. I think the guidance talks about masking unvaccinated folks. And I think that the risk reduction really comes from having both parties masked. So while it's important, while personal choice is important and not everything is right for every family, unless both parties are masked in any particular interaction, the benefit to either party decreases. So my kids are at risk if if they're in a mask and the people they're interacting with are not. Masks in adults are 77% effective in reducing COVID transmission. There are no studies in kids because nobody wants to pay for children's studies, but there's no reason to believe that it wouldn't be similar. There's no decrease in oxygen in the blood. There's no increase in CO2. Those things have been looked at. And I know that kids are very likely to recover and that my kids are likely to have a mild course. But with Delta, it's really like rolling the dice. And it seems to be much more so like rolling the dice than with the other variants. And with the other variants, we had 350 deaths with every single precaution. We took every single precaution we could, and still 350 kids died. I don't think that's a small number. I think that mental health is really important, but the anxiety that I see in my kids is not around masks. It's around not being able to go to school or join activities or do the things they've always done or follow their routines. They honestly don't really care about the masks. And I'm lucky in that. There are a lot of kids that struggle, and that's fine. I appreciate that. I think a lot of it is about how the parents frame it, and the benefit of being able to participate in school and participate in activities, I think is going to be the best support for kids' mental health.
Okay.
And
Thank
that's
you.
it. Very
We're
much.
3 minutes. Thank you, Sarah. I appreciate it. Okay. Because I sadly kind of metaphorically bumped. Sorry, I'm having a hard time getting Sarah off. I metaphorically bumped Andrea Sullivan. I'm going to allow you to talk again, Andrea, and then we will go to Andy Marcinishin and Jules Hoffman. And if the two people who have initials or the name Buddha could please fill in your real name, or then also if you're unable to make it here, if you could also fill out the comment form that went home to all parents and guardians, and we'll send that back out again. So, Andrea Sullivan has left the queue, so I will bring over Andy. Thank you. Hi, Andy. Thank you for
Hi.
waiting.
No problem. Thank you. I'm Sonali Pandya, and Andy Martinez.
Sonali, hi.
Hi. Andy Martinez is my husband, and
Yes.
we are new to Medfield. Our daughter will be starting Dale this year, and we're really excited for the start of the school year. First and foremost, I'm a surgeon. I'm a breast surgeon. I work locally at the hospital. And in terms of what I've seen in regards to the Delta variant has been really humbling. Even with the vaccination and the vaccination rates being high in our county and in our state, there has been a significant exponential increase in number of cases. So that's one thing we definitely have to take into consideration, which wasn't the case last summer when kids started school. Second of all, universal masking has shown a benefit. We have seen a significant decline in influenza and many other communicable diseases that we would traditionally see every year. So there's no doubt that masking works because our kids are not getting the colds and every other week GI bugs that they traditionally were getting. So that's another point. And third of all, being a doctor, when I'm at the hospital, patients come to see us and they have some level of, we have a responsibility to the patients that we wear our mask. Even if I'm vaccinated, my patient may not be. Similarly, when parents are sending their kids to the school, we hope that the staff, the teachers, everyone that's taking care of our children do take that into consideration, that our children are vulnerable. They're not able to get the vaccine. And then everybody does their due diligence and ensures that universal masking is required. That's really the only way we would feel safe to send our daughter to school next year.
Thank you, Sonali. Very much appreciated.
Thank you.
Okay. And talking, I'm going to bring Jules over. Jules Hoffman, please.
Are you seeing a picture of my dog?
I am seeing a picture of your hand, but not of your dog. Not your actual hand, just the Homer Simpson hand. That
I
comes
literally
with it.
just held my hand up to you. I was waving. Okay. I really appreciate the opportunity that we're all getting to talk to you guys again. Maybe that should be assumed, but I think in some towns it hasn't happened. And I think I wrote you guys a bit of a comment today and submitted on the late side, but you
Sorry,
know,
we're still looking.
all right. Yeah, I mean, you guys are being put in this position again. And I think a lot of people in town have empathy that you have to make a big decision and not everybody is going to be happy. So, or feel like their kids are safe, which is even worse. So I'm going to repeat some things that coming from me that have been said tonight, but I figure I may as well say them out loud. I am a proponent of universal masking. I've done a lot of reading, as everyone else has. I've been in parts of conversations with people on all sides of this issue. It makes me sad that so many people are so afraid for so many different reasons. And parents have many different reasons to stand on different sides of this issue. And, you know, everyone's feelings matter. But I am, when it comes down to it, you know, a proponent of universal masking. And, you know, especially in situations where there's not even an especially, there's just the CDC has done a lot of the groundwork for us, where we're all kind of slamming our heads against a wall, trying to figure out what we should do and looking for studies and looking for articles and trying to find experts. And we all know what we want, and we're all looking for that expert that's going to say what we want them to say. And this is being said in mainstream and smaller media platforms. And, you know, you can read until the cows come home, but at the end of the day, the CDC is culling all of this information. And, you know, we're hoping, as the leading medical association of the land, coming up with what studies, what data is the soundest. And I'm kind of deciding that I'm going to bank on what they're saying. I will say that listening to the Board of Health meeting, one thing, having a child who's going to be at Blake, where there is a mix of ages, but also where things went so well last year, and we were a cohort D family, and we're nervous to send her back, and we're just so impressed. We were impressed by cohort D, but really impressed when she came back how safe things were. It was felt a little confused why, you know, mask mandate or no, why there would be no social distancing at lunch indoors. I can see outdoors, they try to get them outside a lot, but indoors really didn't make a lot of sense to me and would really undermine, you know, any masking attempts. Because eating is a time when respiratory droplets fly, because let's face it, kids like to talk while they eat, even if just eating wasn't a problem. And I also just want to mention for the vulnerable families in town, you know, whether the kids are vulnerable in school or they have family members or younger siblings who aren't vaccinated, it's a really scary time. You know, you can have, I think we all thought our vaccines were going to be the ticket to mask freedom. I know I certainly did. I know my child did. And it's not turning out that way. And it's really upsetting. But when it comes to the dangers of masks, I feel like there's a lot of people saying and all kinds of different media that that's a possibility, but yet the leading experts of our country and the leading epidemiologists and pediatric infectious disease doctors right in our own backyard at Children's are saying ventilation is important. Adult vaccines are important. Vaccines are critical. And not everyone's going to make that choice, by the way, and that's their choice. But none of them are really saying don't mask. There was that Wall Street Journal editorial last week that was kind of compelling. But even that, one of the writers of that is a huge vaccine proponent. It wasn't part of that article. So
Julie.
I know the Board of Health doesn't, all right, you're going to wrap me up. The Board of Health does an amazing job. I am wondering if it's possible, if it would be helpful, just as an idea. There are several different infectious disease docs at Boston Children's that are often interviewed and seem open to inquiry. If it would help anyone to reach out to those ones, I'm happy to provide the list I found through media relations to ask what they think for a town in their own backyard.
All right. Thank you very much. Appreciate it. Okay. Then we will go to Sonia M. I'm going to put your hand down. And that looks like at this point, if we could have anybody who is going to choose to comment to really kind of bring it up now, and then we'll try to start wrapping up the meeting. It looks like comments are slowing somewhat. So Sonia, go right ahead.
Hi, how are you?
Very well, thanks. Sonia, what's your last name?
It's Morin.
Okay, nice to meet you, Sonia.
Nice to meet you too. I have two kids, one going into Wheelock and one going into Blake. This might come a little shocking, but I had COVID last year. I'm not vaccinated. And, I'm a single mom with 3 kids myself. And my kids stayed negative through the whole entire thing, while me personally had no help at all. And I am against the masking. Even with me already had COVID, thankfully, like everything was okay with that. But I just don't, me personally, with my kids, even with my kids' feelings about the whole mask thing, they don't want to do it. And I just feel like it needs to be an option for all parents and for the kids, their own opinions and what they want to do. That kind of just stays open as far as the guidance. And that's pretty much all I have to say about that.
Thank you, Sonia. I very much appreciate it.
Thank you.
Thank you very much. And I'm glad that you are in good health now.
Thank you.
Okay, I see Kristen Kumar, and I'm going to bring her over. And then I think at this point that will be with the committee's agreement, unless we see a kind of an avalanche, our last commenter for the evening. Be all right. And then, of course, we will always distribute the, as I've said all night, we will distribute the comment form again, as well as the recording of this meeting. Okay, and Kristen, would you like to go ahead?
Thank you, Jess. Thanks for taking my
bet.
call. I would like to preface this by saying that my kids are vaccinated and fairly safe. But being a nurse and having a very scientific mind in all my research, I find that universal masking is definitely the safest option. You know, people say, oh, mask your kid, but that doesn't help if the person sitting next to them all day is not masked and is infected. So that's kind of my take on that. And I talked to my kids who are a little bit high maintenance. And I said, do you mind wearing a mask at school if it's going to keep other kids from getting sick? And they said, not at all. They don't mind at all, even though they're vaccinated. And I think in the upper grades, if you say the unvaccinated kids don't have to wear one, it kind of singles out the kids that the vaccinated kids don't have to wear a mask. It singles out the unvaccinated kids, which could lead to some other issues down the road. And as someone said before, with the Delta especially, it has an R naught of 6.5, which means each infected person could go on to spread it to 6 or 7 other people, which is a lot higher of an R naught than the other original virus. So I really, even though my kids are vaccinated, I don't even want them to get a breakthrough case because we don't know the long-term effects of COVID. So I just wanted to pop in here to say that I am absolutely a proponent of universal masking for all grades.
Okay. Thank you, Kristen.
Thank
Very
you.
much appreciated. Okay. So I would like to thank all of you. Those of you who have hung with us, there's still 141 people here. We're going to close this to comments now. Is there anything at this point, Dr. Marsden, you would like to say in terms of wrap up? I know that
I just appreciate all the feedback. I know that, whatever decision is made is not going to please everyone, but I think that everyone needs to know that we always have the kids' best interest in mind. That's how we'll make that decision going forward.
And we do continue to value your input. That comment form, as I again say, will be open until Monday, August 23rd at 5 p.m. So I can have 2 hours to kind of get it wrapped up and take a look at the data for our deliberations. We will be deliberating on August 23rd. And again, I just want to mention that any opinions offered here across the board should be evaluated with a trusted source to kind of, for yourself, vet and do your own research around a lot of the things that have been said tonight. I am certainly not an expert. None of us on the committee are epidemiologists. I'm sure Dr. Marsh never expected to have to be one. It was tough enough to be a meteorologist. We do have true experts on our Board of Health, and we will continue to interact with them and ask for their advice up to, including, and beyond the time that we would be making a vote on how our school year will proceed. And just to let you know, as I just mentioned, our next regular meeting will be on August 23rd at 7 p.m. I will continue, and we will all continue to look at the comment forms and take that into consideration. I will send out an email tomorrow with the links, and our future agenda items will be, obviously, to the folks who are here, the most important at this point would be deliberation and vote on the September opening risk reduction plan. We will also be looking at the school committee role reorganization, which we do yearly, and an update on the MASC policy manual project. So given that, do I hear a motion to adjourn our meeting? No? Thank you, Leo.
Anna Mae.
Leo and Anna Mae second. All in favor?
Aye.
Leo? Tim?
Aye. Yes.
Anna Mae?
Yes.
Megan Glenn?
Yes.
And Jessica Riley? Yes, and the meeting is adjourned at 8:41 p.m. Thank you all so much, and please continue to communicate with us.